Summer should be filled with days at the beach, picnics in the park, and road trips with friends, but it can be difficult for those living with eczema. Today, we're joined by board-certified dermatologist Dr. Adam Friedman, who has more on a new treatment for eczema and how children and adults can manage this disease and maintain clear skin. Dr. Friedman, thanks for joining us today.
Oh, it's my pleasure.
First of all, tell us, what is eczema exactly, and what are some of the symptoms?
So atopic dermatitis, which is the most common form of eczema, affecting over 25 million Americans alone, is a chronic inflammatory condition that comes and goes and is certainly disabling, destructive to one's quality of life and, of course, skin. Now, it comes in a lot of flavors with respect to how it appears, from pink to red to even purple patches or plaques that can be flaky, cracked, oozy, or even blister. The spectrum is extraordinary across ages, gender, and even skin tones. So sometimes making the diagnosis can be a challenge, and that's where someone like me comes in terms of seeking help from a board-certified dermatologist. Because this is so impactful, I've partnered with Arcutis to raise awareness about this condition, but also, to your point, talk about ways to manage it to get clear skin.
And then what about in the summer? Can the summer weather affect eczema flare-ups?
Yeah, I mean, this can be a year-round condition, but the summer, including the heat, which we've had quite a lot of, the sweating that ensues, but also products we put on our skin, such as sunscreens or bug sprays, those can easily make a flare worse or even bring about one if you're sensitive to some of those things. So unfortunately, the weather can absolutely impact this condition, making it hard to enjoy yourself when you're supposed to be outside and really getting involved with activities during the summertime.
So what are some ways that you can care for your skin if you have eczema?
Yep. So regardless of severity, certain rules always apply. These include minimizing soap use, and when using soap, using ones made for eczema, and I'll say that on the label. But more importantly, applying a moisturizer to damp skin after the bath or shower to lock water in, which is so sorely needed for the skin to make itself the right way and protect us from the outside world. Now, when that's not enough, there are multiple FDA-approved therapies, both topical and ones that work from the inside out. The most recent being approved is roflumilast, or Zoryve 0.15% cream, that can be used once a day for mild to moderate eczema for those 6 and up. So we're covering a broad range of ages who could be affected by this condition.
And then finally, where can we go for more information?
Yep, so someone like me, a board-certified dermatologist, or Zoryve, ZORYVE.com for information about this new medication and, of course, the condition itself.
All right, Dr. Friedman, thank you so much.
My pleasure.